Welcome to Take 5, an inventory series, where we tell you everything going on in healthcare worth hearing. I'm Alex Diamond, and this week was a special occasion for an interview because CEO Carl Nattenstedt and I spoke to the latest recipients of Z5 Inventory's 50-4-50 program. Periodically, Z5 spins a literal wheel of charities submitted by the public to see who will receive a donation of $5,000. This time, it was Family Services, an organization providing all kinds of support for in-need communities in Maryland as a part of Shepherd Pratt's Community and Family Services line of programming. You'll hear first Jennifer Carberry, Division Director of Community Services, then Carla Hoffman, the Director of Community and Family Services.
We just wanted to learn more about what you guys do and, what we're supporting. That's really it.
Well, that works a little backwards, doesn't it? We got the check before we even told you who we were. You really spun the wheel, gave us the money, and now you want to know all the great work we do.
Let's tell them how worthy we are. We do a lot of work with special populations through my division, and it's a lot of work that we do in the public school system with primarily elementary and middle school age children whose families are really struggling. It can be with acculturation issues. It could be, poverty, access to care, lots of different things. But some of the populations we serve are families who are fleeing violence from Central America, and they have gone through extensive trauma getting here. We embed social services and mental health practitioners in the school, full-time people in the school to work with those families. We also have a program that works with children who are referred to the crisis center in Montgomery County. There's kids who are not severe enough to be hospitalized at the time, but whose symptoms are serious enough that they warrant more than a once-a-week therapeutic intervention. It's got a clinical component, but there are also folks that are called home stabilizers, and the goal of that program is to stabilize those families in like a 2 to 3 month period, see them frequently, go into the homes and work with them, help them learn some new skills, but ultimately to connect them with the longer term services that they're going to need to be able to stay out of hospital and residential treatment.
We really have this continuum of care that almost regardless of what problem that you present with or what age you present with or what language you present with for mental health or social services, there is a program that we can connect any of your family members. You can have a child with depression. We'll see you in the school-based or the clinic. You can need housing. We refer you to housing, substance use. We have Partners in Recovery, which is a large substance use program. Pretty much you need food. we connect you to emergency food supplies.
We're doing a lot of food and diaper distribution lately.
There is food and diapers. And so it is a real continuum of care that can't serve all in one program, but within our network can touch.
We also have a program that works with children whose parents are in jail. It's a really cool program. We work with the parents while they're in jail. We do parent groups and activities, and we facilitate communication with their kids outside. Some of the research around that talks about how parents whose connection to their children improves while they're incarcerated reduces their long-term chances of recidivism.
So what we're trying to do, I think, with all of these programs is improve the functioning of the individual who presented in front of us. And so that could be in your elementary school, you get identified as a restless 6-year-old. And is that ADHD or is that trauma? Is that issues of divorce? And so all of those things are worked through in some of low-level programs to hopefully never come to a high-level program such as myself that you would need medication or intensive therapy on that part. So the work that we do, I do think, catch it early, treat it early, work on those self-esteem issues and resolving that trauma. And we just are supporting people and their families to go on and live productive lives.
That's all the time we have for this week. But we will have more with Jennifer Carberry and Carla Hoffman from Family Services in our next episode. While you're waiting, get more information on how you can get involved with the charity featured today, or nominate a charity you think deserves a $5,000 donation at z5inventory.com. That's the letter Z, the number 5, and the word inventory.com.